Boxer dogs and brachycephalic syndrome, caring for flat-faced breeds. Boxer dogs and other flat-faced breeds, such as Bulldogs and Pugs, are undeniably adorable with their squished faces and expressive eyes. However, these breeds are also prone to a unique set of health concerns, including a condition known as brachycephalic syndrome. In this video, we will delve into the specific care requirements and potential risks associated with this syndrome, shedding light on how to best care for these lovable flat-faced companions. Brachycephalic syndrome is a condition commonly seen in flat-faced breeds like boxers. It is characterized by a combination of anatomical abnormalities that can result in respiratory difficulties, heat intolerance, and other related health issues. The shortened snout and compressed airways can make it challenging for these dogs to breathe properly, leading to symptoms such as noisy breathing, snorting, coughing, and exercise intolerance. Additionally, their unique facial structure makes them more susceptible to heat stroke as they struggle to regulate their body temperature effectively. Managing brachycephalic syndrome requires a comprehensive approach to ensure the well-being of these dogs. One crucial aspect is respiratory management, which involves strategies like weight management to prevent excess pressure on the airways, exercise restrictions to minimize respiratory distress, and even surgical interventions in severe cases. It is important to work closely with a veterinarian to determine the most appropriate course of action for each individual dog. Medical treatments can also play a role in alleviating the symptoms associated with brachycephalic syndrome. Medications may be prescribed to help open up the airways and reduce inflammation, while breathing aids like nasal dilators or oxygen therapy can provide additional support. However, it is essential to note that these treatments aim to manage the symptoms rather than cure the underlying condition. Aside from medical interventions, lifestyle adjustments can significantly improve the quality of life for boxers and other flat-faced breeds with brachycephalic syndrome. Providing a cool and well-ventilated environment is crucial, as these dogs are more prone to overheating. Avoiding strenuous activities that can put excessive strain on their respiratory system is also important. Additionally, using harnesses instead of collars can help minimize pressure on the neck and throat, further improving their breathing. Prevention is key when it comes to managing brachycephalic syndrome. Regular veterinary checkups are essential to monitor the overall health of these dogs and catch any potential issues early on. Dental care is also crucial, as dental problems can exacerbate respiratory difficulties. Proper grooming practices, such as keeping the facial folds clean and dry, can help prevent skin infections that can further complicate their health. For boxer dog owners, it is important to be aware of the breed-specific challenges related to brachycephalic syndrome. Early socialization and training are crucial to ensure these dogs are well-adjusted and comfortable in various situations. Ongoing monitoring of their health is essential, as early intervention can greatly improve their quality of life. By understanding and addressing the unique health concerns of flat-faced breeds like boxers, we can ensure that these lovable companions thrive and live their best lives. Understanding brachycephalic syndrome. Understanding brachycephalic syndrome. Brachycephalic syndrome is a condition commonly seen in flat-faced breeds like boxers. It is characterized by a range of respiratory difficulties, heat intolerance, and other related health issues. This syndrome is unique to dogs with short, pushed-in faces, and it can significantly impact their overall well-being. One of the main challenges faced by dogs with brachycephalic syndrome is their compromised respiratory system. The shortened snouts and narrow airways of these breeds make it harder for them to breathe properly. As a result, they may experience symptoms such as noisy breathing, snorting, and coughing. Additionally, these dogs are more prone to exercise intolerance and are at an increased risk of heat stroke due to their reduced ability to regulate body temperature. Aside from respiratory difficulties, brachycephalic syndrome can also lead to other health issues. These may include dental problems, eye infections, skin fold infections, and gastrointestinal issues. The unique facial structure of flat-faced breeds makes them more susceptible to these complications. It is crucial for owners of boxers and other flat-faced breeds to understand the challenges associated with brachycephalic syndrome. By recognizing the symptoms and taking appropriate measures, such as providing proper care and seeking veterinary guidance, owners can ensure their pets lead healthy and comfortable lives. Recognizing the symptoms. Recognizing the symptoms. It is important for owners of boxer dogs and other flat-faced breeds to be able to recognize the signs of brachycephalic syndrome. This condition is characterized by a range of symptoms that can affect the respiratory system and overall health of these dogs. By being aware of these symptoms, you can take appropriate action to ensure the well-being of your furry friend. One of the most common signs of brachycephalic syndrome is noisy breathing. You may notice that your boxer dog makes loud snorting or snoring sounds while breathing. This is due to the anatomical abnormalities in their airways, which can cause breathing difficulties. Additionally, coughing can also be a symptom of this syndrome, as the airways can become irritated and inflamed. Another symptom to watch out for is exercise intolerance. Boxer dogs with brachycephalic syndrome may struggle to engage in physical activities and may tire quickly. This is because their compromised respiratory system makes it harder for them to breathe during exertion. It is important to keep an eye on your dog during exercise and provide them with plenty of breaks and rest. Heat stroke is another serious risk for boxer dogs with brachycephalic syndrome. These breeds are more susceptible to overheating due to their compromised ability to regulate body temperature. If your dog exhibits signs of excessive panting, drooling, or weakness in hot weather, it is crucial to take immediate steps to cool them down and seek veterinary attention. By familiarizing yourself with these symptoms, you can be proactive in addressing the health needs of your boxer dog. Early recognition and intervention can help prevent complications and ensure a better quality of life for your beloved pet. Respiratory management. Respiratory management plays a crucial role in improving the respiratory health of boxers with brachycephalic syndrome. This condition, characterized by respiratory difficulties, requires special attention and care. Here are some strategies that can help. Weight management. Maintaining a healthy weight is essential for boxers with brachycephalic syndrome. Excess weight can further strain their respiratory system, making it harder for them to breathe. Consult with your veterinarian to determine the ideal weight for your boxer and develop a balanced diet and exercise plan to achieve it. Exercise restrictions. While regular exercise is important for a dog's overall health, it's crucial to be mindful of the limitations of boxers with brachycephalic syndrome. Avoid strenuous activities that can put excessive strain on their respiratory system. Opt for gentle walks and play sessions that allow them to stay active without overexerting themselves. Surgical interventions. In severe cases of brachycephalic syndrome, surgical interventions may be necessary to improve the dog's breathing. Procedures such as rhinoplasty, soft palate resection, and nostril widening can help alleviate respiratory difficulties. Consult with a veterinary specialist experienced in brachycephalic syndrome to determine if surgery is the right option for your boxer. By implementing these strategies, you can significantly improve the respiratory health of your boxer with brachycephalic syndrome. However, always consult with your veterinarian for personalized advice and guidance based on your dog's specific condition and needs. Medical treatments. When it comes to managing brachycephalic syndrome in boxer dogs and other flat-faced breeds, there are various medical treatments available that can help alleviate symptoms and improve their quality of life. These treatments include medications and breathing aids that target specific respiratory issues commonly associated with the syndrome. One option for medical treatment is the use of medications to address respiratory difficulties. These medications may help reduce inflammation, open up airways, and improve breathing. They can be prescribed by a veterinarian and may include bronchodilators, anti-inflammatory drugs, and antibiotics to prevent or treat respiratory infections. In addition to medications, breathing aids can also be beneficial for boxers with brachycephalic syndrome. These aids are designed to help improve airflow and make breathing easier for dogs with compromised respiratory systems. One example is the use of nasal dilators or stents, which can help keep the airways open and reduce breathing difficulties. It's important to note that medical treatments should always be prescribed and supervised by a veterinarian. They will be able to assess the severity of the condition and determine the most appropriate treatment plan for each individual dog. Regular checkups and monitoring of the dog's response to treatment are essential to ensure the best possible outcome. Overall, exploring different medical options, such as medications and breathing aids, can significantly improve the symptoms and overall quality of life for boxers with brachycephalic syndrome. However, it is crucial to work closely with a veterinarian to develop a personalized treatment plan that addresses the specific needs of each dog. Lifestyle adjustments. When it comes to caring for boxers with brachycephalic syndrome, making certain lifestyle adjustments can greatly improve their overall well-being. These modifications are aimed at minimizing the respiratory difficulties and heat intolerance commonly associated with the condition. One of the most important lifestyle changes is to provide a cool and well-ventilated environment for your boxer. This can be achieved by ensuring proper air circulation in your home, especially during hot weather. Consider using fans or air conditioning to keep the temperature comfortable and reduce the risk of heat stroke. In addition to environmental adjustments, it is crucial to avoid strenuous activities that may put excessive strain on your boxer's respiratory system. Brachycephalic dogs are more susceptible to respiratory distress, so it is best to opt for low-impact exercises that do not require intense exertion. Short, leisurely walks and gentle play sessions are ideal for keeping your boxer active without compromising their health. Another lifestyle modification that can make a significant difference is using harnesses instead of collars. Collars can put pressure on the neck and throat, potentially exacerbating breathing difficulties. By using a harness, you can distribute the pressure more evenly across your boxer's body, reducing the strain on their respiratory system. By implementing these lifestyle adjustments, you can help your boxer with brachycephalic syndrome lead a more comfortable and fulfilling life. Remember, always consult with your veterinarian for personalized advice and guidance on how to best care for your beloved boxer. Preventing complications. Preventing complications. When it comes to brachycephalic syndrome, prevention is key to ensuring the well-being of boxer dogs and other flat-faced breeds. By taking proactive measures, you can significantly reduce the risk of complications associated with this condition. Here are some preventive measures that every boxer owner should be aware of. Regular veterinary checkups. Schedule regular visits to the veterinarian to monitor your boxer's overall health and address any potential issues early on. Your vet can provide guidance on managing brachycephalic syndrome and recommend appropriate treatments or interventions. Dental care. Flat-faced breeds are prone to dental problems due to their unique facial structure. Regular dental cleanings and proper oral hygiene, such as brushing your boxer's teeth, can help prevent dental issues that can exacerbate respiratory difficulties. Proper grooming practices. Keeping your boxer's facial folds clean and dry is essential to prevent skin infections. Regularly clean the folds with a gentle, vet-approved cleanser and ensure they are thoroughly dry to minimize the risk of bacterial or fungal growth. By implementing these preventive measures, you can help reduce the likelihood of complications arising from brachycephalic syndrome. Remember, early detection and proactive care are crucial in managing the health of your boxer and ensuring they live a happy and comfortable life. Special considerations for boxer owners. Boxer dog owners should be aware of the breed-specific challenges related to brachycephalic syndrome. While all flat-faced breeds are at risk for this condition, boxers have their own set of considerations. Early socialization is crucial for boxers as it helps them become well-adjusted and confident dogs. This can help reduce stress and anxiety, which can exacerbate respiratory issues associated with brachycephalic syndrome. In addition to socialization, training is essential for boxers. Proper training can help them learn basic commands, manners, and leash etiquette. It is important to use positive reinforcement techniques and reward-based training methods to encourage their cooperation and prevent any unnecessary strain on their respiratory system. Boxers are intelligent and eager to please, making them highly trainable. Ongoing monitoring of a boxer's health is vital to ensure early detection and management of any symptoms related to brachycephalic syndrome. Regular veterinary checkups are recommended to assess their overall health, monitor their breathing, and address any concerns promptly. Boxers may also require special dental care due to their unique jaw structure. Regular brushing and dental cleanings can help prevent dental issues that can further impact their ability to breathe comfortably. By being proactive in socializing, training, and monitoring the health of their boxer, owners can provide the best possible care for their beloved pets. Understanding the breed-specific challenges associated with brachycephalic syndrome is crucial in promoting the well-being and quality of life for boxers.